cancer diagnosis is life-changing, not only for the person diagnosed with the cancer, but it also affects their family and friends. If you have children, or if you have a child, should you tell them that you have cancer? This is a question I get asked all the time, and in my opinion, the answer is yes. You should tell your children that you have cancer. So what may be the possible effects if you do not tell your children? Number 5. Children are more intuitive than we give them credit. They will sense that something isn't quite right. There's something off with the routine, you're going to the hospital more often, there seems to be more stress and perhaps sadness in the house, and they will be wondering what is up. Number 4, children may blame themselves. We know that children, they have a fertile imagination, and they may be wondering whether they've done something wrong to cause this upset, especially if this isn't talked about openly. Number 3, children may feel excluded. They may feel that they are not important enough or may even feel isolated. If previously there is a sense of togetherness in the family and all of a sudden things have shifted, they may feel alone with worries they can't talk about with anyone. Number 2, they may find out from other friends or family members. You see, keeping a secret can be quite hard and stressful, and it's always a possibility that children may find out the news from a different source. This can make the discussions about the cancer diagnosis in the future even more difficult. They may also feel angry and hurt that you didn't feel you could tell them yourself in person. And lastly, they may feel scared. If they sense something is wrong but don't really know why, they may feel scared and vulnerable. They know something is up but nobody's talking about it. And they may not feel able to ask questions, and as a result, they worry even more. Talking about cancer to anyone can be challenging and difficult, let alone doing it with children. But the benefits of doing this can be huge. It can bring you closer together as a family. You can feel unburdened by not having to keep a secret. And the children know that you are there to provide support for them. And so there will be trust instilled between yourself and the children, which is something really important, especially during challenging times. The children will also feel valued as they have been part of this discussion. They have also been given permission and the space to openly talk about their worries and concerns. So are there things you can do in preparation? Familiarize yourself with your diagnosis and gather as much information as you can. You can tell your breast care team that you are going to tell the children, and they may have other advice to give you. Schedule it in your diary and block out time. Make sure you will be around afterwards to provide support for them. You may want to do it over the weekend, for example, and it's best not to do it before bedtime, as they will ruminate over it all night. If you have more than one child, try to break the news with them together. If you can't do this, try to get the timing as close as possible. This way, there is no wondering why other siblings were told first. Try not just to tell the older children or eldest child only. This can be quite burdening on them. If there are 2 parents, it's best for both to be present at the same time, which will give them a sense of unity and togetherness. If you're on your own, perhaps have a close friend that your children know, so that they can provide support for yourself as well as the children. But if you feel you can do it yourself and you would rather do it yourself, then that's absolutely fine. Whatever works best for you. And lastly, anticipate possible questions they may ask and prepare answers for them. Think about the language you will use and make it simple for them to understand. So, when should you tell them? It is never a right time, but this doesn't mean that it should be avoided. You should tell them as early on as possible, as the longer you leave it, the more stressful it will be to keep it a secret. You may want to wait though until you have a treatment plan and you know what lies ahead. If you do it that way, there is less unpredictability and the children will know their direction of treatment. How should I tell them? Well, I would suggest you make it as a conversation. Ask them what they know and let that guide where the conversation goes. Listen to their concerns and worries and try to answer their questions in a simple way for them to understand. Explain to them what the next few months may look like based on what the treatment plan is, whether they are with hospital visits, if you're going to have surgery or chemotherapy treatment. And if you can, you may want to explain how these treatments may affect you so they can be prepared. I would also encourage them to ask questions. What you think they want to know may not be the same as what they want to know. And it's actually okay to say, I don't know, to their questions. But at the same time, reassure them that you will find out what the answers to their questions are and get back to them. Try not to dismiss their questions, worries or fears. Do acknowledge them. Reassure them that this is not anybody's fault. cancer can just happen. And younger children may feel that they can catch cancer, so reassuring them that this is not the case can be helpful too. Let them know it's okay to hug, kiss and cuddle, and that these normal behaviors can continue without causing harm. Talking about cancer can be challenging, and don't worry if the chat doesn't go to plan. This is the first conversation of many, but at least it has started.